And last thing I'm going to talk about is very controversial. It's COVID. Okay, COVID and responsibility. So COVID, COVID-19, the pandemic. Interesting. The nations and areas hit hardest were urban, overweight, and unhealthy. There was an average of something like 4 comorbidities when someone died, from COVID. Now, obviously, you can just get really sick, and there's long COVID as they call it. But if you are an unhealthy person, that might be due to your decisions. It might not be. Okay, but the most people that died of COVID were unhealthy. They had 4 comorbidities, which means that these 4 other things could have killed them as well. Okay, the people that I knew, and this is just anecdotal, but the people that I knew that died from COVID, if you would have said they died and we weren't in a pandemic, you would go, yeah, probably. He was, 79 years old and smoked a pack of cigarettes a day and drank whiskey and never exercised. Like, yeah. Okay. Now that's not to say that person deserves to die or anything. It does not say it's not tragic, but what is your responsibility to be as healthy as possible? So when a disease hits us, when a virus hits us, that you are able to be resilient. It's interesting to see the areas that were the most hard hit, around the world and within America, because those were the areas that had the most obesity. And, you're obese, your body's working really hard to get, nutrients and everything, blood flowing to all those tissues. So when you get hit with a respiratory virus, your body is already under so much work. That's why walking up a flight of stairs is so difficult for you. Now you have to fight off this virus. It's a real virus. Like now you got to fight it off and your body just can't take it and it might expire. But the way that we approached this was generally with lockdowns, vaccine passports, and things like that, instead of responsibility. Personal responsibility, like protect yourself. If you want to wear a mask, wear a mask. If you don't, you don't. Like keep your distance. If you're sick, stay inside. We just had this like blanket policy of everyone needs to do this. Everyone needs to do the exact same thing, but people are different. Someone with 6 comorbidities is very different than a professional athlete. Okay. And yet we use this like one size fits all approach. One size fits all does not work for education. It definitely doesn't work for health. Okay. It doesn't work for diets. Okay. But yet we took that approach. So this idea that I want to propose is government needed to mandate healthy decisions like vaccines and masks, and why these things, why social distancing, why vaccines, why, masks and not other things. It's very interesting that the government talked a lot about, social distancing, but they didn't talk a lot about exercise, and obesity was directly connected to negative COVID outcomes. Any kind of mandate that was proposed, where does that fall constitutionally? Like, in the Constitution, can you be forced to wear a mask? I mean, the Constitution says, promote the general welfare. So that's why they would try to get away with it. But like there's negatives to masks too. I remember being at the gym and I was sweating a lot and I was breathing in this mask that was sopping wet and I'd have to wring it out. That can't be healthy. There's negative elements of wearing a mask. I talked about that in the externalities about washing up on the beach. Little kids that might be deaf and learn how to read lips, or kids who have trouble like picking up on emotions and things like that. Like there's a lot of stuff that were negative to wearing masks. Another thing that I saw during COVID was healthcare workers refusing to treat the unvaccinated. Late night talk show hosts were like, oh, if you don't get the vaccine, then you can just go die. It's like really harsh, but it's very interesting because healthcare workers, they're so amazing. They take care of people who make terrible decisions. People who drink a bottle of whiskey and smoke 2 packs of cigarettes a day and jump their motorcycle over a flaming school bus and then crash and break their arm, they will fix their arm. It's really incredible. But when it came to this issue, they said, we refuse. And it wasn't a lot, but it was enough. Like, it's so interesting to me that this issue, and that clearly was because they were pushed into this propaganda machine of good people get the vaccine and bad people don't. Okay. But you could apply that to all kinds of things. And the beautiful thing about healthcare workers is, in general, the ones that I met, the ones that I'm friends with, they will treat anybody, even if they made really bad decisions. What were you thinking drinking a bottle of whiskey and jumping a school bus on a motorcycle? It's like, I know I was dumb. Well, don't do that anymore. Let me fix you up. And that didn't seem to happen with a lot of healthcare workers during COVID. One of the questions that I was asking a lot during COVID, both in person and on my social media channels and things, is what can we do to get through this properly? I asked my doctor at the time, he's not my doctor anymore. And I said, what can I do just in case, like break glass in case of emergency to avoid negative COVID outcomes? And All he said was the same thing that Anthony Fauci said and Albert Bourla, the CEO of Pfizer, said, which is just get vaccinated. Just get vaccinated. Wear a mask, social distance, get vaccinated. And it's like, wait a second. And I asked questions. I was like, what about cardiovascular exercise? I mean, it's a lung disease. Wouldn't it be better if my lungs were stronger? You know, what about vitamin D supplementation? Wouldn't that be nice to get vitamin D supplementation? And the response was kind of like, oh, yeah, it'd be fine. Yeah, it's fine. Like, it wasn't even like an issue. We didn't see that at press conferences enough about like lowering body weight, getting good exercise, going out and getting sunlight like that. We were told to stay inside, where a lot of people with negative COVID outcomes had a vitamin D deficiency. You know, just getting a lot of rest. Like, this stuff wasn't promoted. It was this one size fits all thing. And, you know, that doesn't take, you know, they would say it's a responsibility of you to get your vaccine, but not the responsibility of you to live a healthy lifestyle, to get a lot of sleep, to, you know, supplement the ways that you need it and eat a healthy diet and lower your body weight and get good cardiovascular exercise. Why not that element of responsibility? Why only this element? Do the responsible thing, get vaccinated. Okay, but what about all these other areas? So people had these blind spots about when it came to COVID, and it became very politicized, and I think that's not ideal.